Elder Cardinal and minister and staff, and so many friends here. It's so wonderful to be back in Alberta and see so many some people see so many new faces and people who are committed to this important business. I was coming here, I was sitting next to a fireman, and I was just thinking, man, people think he's such a good guy. He's a hero. He's saving people. Society loves him. And he asked me what I did. I said, I'm a social worker. Oh, it's not the same reaction, but it's the same process. The people that aren't in this room are the people that are investing in circumstances that are generally beyond comprehension to many in this room. They're dealing with circumstance that police very clearly have identified as some of the most dangerous stuff that they do, going into families that are full of addiction and mental health issues and violence and guns and on and on. And these people do it routinely. They're heroes. We seem to come at it from the fringes, and it's understandable. The death of a child, there's nothing can be more compelling. But there's a whole other story that never gets talked about. And that's the incredible success that this system has on a general basis. Just talking to John Reeves, there's hundreds of kids less in care now, Aboriginal children, year over year. Caseloads are stable, on and on. Is that good or bad? I don't know, but it's sure worth talking about. And it's sure important to be talking about in the context of all this oversight. If the only information you're getting is about tragic circumstance, do not be surprised that it is done defensively. It'll generally be edited to death. We'll give you only what we need to give you to get away with that experience. Reach out. Go down into the system. Talk to the people who are delivering service, and you'll find yourself not only getting a better understanding, but the staff and system getting a better understanding of who you are. I still talk to staff even though I'm in Manitoba. And I'll tell you two things they never ask for. More assistant deputy ministers and more quality assurance oversight committees. They have a whole bunch of other stuff that they think is pretty important. Every time there's a catastrophe in Canada, we have a couple of ways of dealing with it. But at the end of the day, it generally ends up with a reorganization of some sort. We decide, based on a child death, that system needs to be bigger, or the agency needs to be smaller, or it needs to be private, or it needs to be public, or it needs to have a board, or it shouldn't have a board. And on it goes. And this has been going on for so many years that you have to kind of guess at the end of that there's some reason that we continually are that dysfunctional. There's some balance there that gives us some comfort. Staff want to know what their job is, and sometimes they don't know because it's driven by language of catastrophe. The minister made some wonderful statements today about the significance of keeping families together and children safe. I've had the misfortune of reading some editorials by distance and hearing language of system broken, seeing tombstones over some type of grave that says rest in peace to kids in care. What horrible messages, shameful messages. That's not what this is about. It's about caring as a community for your children. And you can put a social worker in every home, and that's not going to change the potential periodically for tragedy. But for God's sake, help them understand what their primary function is and support them. The system is tired, my friends, and I'm talking system in the most national and general sense. The system is tired of people sneaking up on them and finding out what they're doing wrong. It's exhausting. And the platitudes of, we like these guys and they're hardworking and aren't they okay, changes very quickly when there's a need for some type of identified problem. Because of the time restraints, I won't bore you longer, but I want to leave you with 2 or 3 direct recommendations that are nothing more than my sense of the world. Number 1, never be fooled that the calling a child a ward makes them better or different the next day. Taking a youngster into care is one of the more dramatic moments done by professional people in the toughest circumstance. But it's the beginning of a process, not the end of a process. And the history of that child and their family and their community, every bit is much more of an influence than our specialized expertise. Second of all, the need for an educated and trained workforce is critical. The University of Calgary has been a strong advocate for a professional workforce. Thank God for them. The next step, I hope, is that professional sequencing becomes more and more looking like either a Bachelor of Child Welfare or specialties in child welfare, so that no longer do we have to be embarrassed about people not wanting to come into our business and ending up there since we're the prime employer. I remember clearly, Gail, a story that you shared, and I use it wherever I go in Canada, sitting at a dean's meeting, and one of your colleagues saying, "Thank God, great news, not one of our graduates has gone into child welfare this year." Horrible stuff, horrible stuff. We need to salute them. We need to tell the story. We need to be proud of them. We need not to be defensive. We need to go talk to editorial boards. We need to tell them a truth that isn't based on a 0.05% problem. We need to talk about the 99.9% issue. Find the successes, they're there. The final message is, we must stop being afraid of the people that we serve. When I was a young social worker, and that I don't need any smart comments, I don't think there was computers, there was still Gestetners and stuff. A lot of people spent time there because of I think the smell of the glue or the ink. I was told as part of my, education/training, university education and supported by training. Aboriginal kids, when they come into care, do much better if you put them in another country. That was my training. So if they become permanent wards, my job was to find a home for them in Belgium. Isn't that crazy? Magical thinking. It's true. That's what happened. And I saw those same kids stumble across the border back into Manitoba, not having a clue who they were as young people. And then becoming parents, and on and on and on this went. Well, I had experts telling me to do that. I had experts telling me that kids with some form of developmental disabling condition should be put in a building somewhere, and parents should start again. Experts told me that. Sound crazy now, but experts told me that. They told me that kids do real good in long-term locked care without seeing their parents. And that my job as a social worker was to protect the foster parents from mums and dads because they'd get in the way. That was the way we did business. My point being, never be fooled by expertise being consistent, constant, and congruent. We're an evolving field. We have to look at our data. We have to read. We have to listen. We have to talk. But the real soundstone for us, the real encyclopedia of learning, is the people that we serve. Coming from Manitoba, I can say with great pride and nervousness at times, Billy, that the real power of transformation is always in the community. Most of these organizations being run by single women who are trying to make their business stay alive by clothing raffles and selling banana bread recipes. They're the ones that are ensuring safety, not the formal system. They're the ones that when they invite social workers into their world, the world of social work becomes a manageable, safe, happy, unafraid place. We have to become the system that doesn't run in to areas and treat them like the hood and run out at 4 o'clock in the afternoon because we're so terrified of nighttime. We have to see the strengths. We have to see the strengths in the community, in our families, in our social workers, in our commitment as a government to try to make sense out of a very, very confusing piece of business. I urge you as your committees and your groups, wherever possible, to try to bring operational leadership to the table. Not only is there information critical as you go in your search for truth and change and improvement, but it's also a critical message to the people that work for that person and the fact that they're being heard and affirmed. Foster parents, Catherine, have heard for years language like, "You are the backbone of our system." That gets so stale and gets so meaningless when criticism is not based on fact, but on intuition about problem. Bad people find their way into our work. Even when we do good reference checks, sometimes criminal behavior happens both in families and happens both in circumstances when kids are in care. We're not perfect in that. You're exactly right. We're not perfect. But it should be no surprise that the threshold of zero tolerance, that a child will never be heard in care, will never be achieved. And I don't want to ever make that sound like we should lose or lessen our commitment to try to get to that state. But for goodness sake, we have to be realistic as well about the proposition in which we find ourselves. Sneak up on somebody and find the success. It's all around us. And I wish you nothing but wonderful success in the important work that you're taking on. And I know this department is trying so hard to make some sense out of this complex business. So thank you for your time.